Not all things are created equal. It's a phrase many of us are aware of, yet in medicine, it's not always applied and definitely not appreciated. A therapy is not just a therapy. The quality and number of differentiating factors of any single treatment dictate the results. And when I say that not all hyperbaric oxygen therapies are the same, today's guests understand that all too well. I was able to check out their beautiful facility and felt I had to have them on and share their knowledge on the subject. So, without ado, this is the story of Aviv Clinics with Dave Globig and Dr. Mohammed Elamir. Guys, thanks so much for coming on the podcast and great to see you again.
Good morning and great to be on, Casper.
Yeah, I went down there and Dr. Elamir, I'm going to actually start with you because you gave a great presentation when I was down there in Florida checking out the facility, and you talked a lot about the science. And before we jump into that big subject, I did want to kind of go into your background and how you got into hyperbaric oxygen therapy, and particularly how you got to Aviv.
Yeah, absolutely. So I'm Dr. Mo Elamir. Everybody, in the clinic, makes fun of me because I'm from New Jersey. So if anybody's from Jersey there, I could use some support down here in Florida. But I went to Rutgers University and I did my residency training in internal medicine with the Robert Wood Johnson program. So I'm a board certified internal medicine physician, and I was part of the standard medicine practice. I had 3 offices, rounded on my own patients in the local hospitals in Jersey City, and even saw them in the local nursing homes. So kind of the old school way of practicing medicine that doesn't really exist nowadays. But I was seeing patients, every day, up to 50 a day, and, loving my patients, loving my practice, but always looking for something new. I wanted to do more for my patients and in medicine. Around that time, my late father, who was a neurologist, suffered a small stroke. And that stroke took away his speech. He became aphasic. He could say about a few words, pretty devastating. But thank God, physically, he was fine. But it led me to researching, how can I heal his brain after the stroke? In medicine, we get trained so much about time is tissue. Treat that stroke as soon as possible, within 4 hours or so. But there isn't much about what you can do after the fact. So in my research, I found a few studies from Israel, from Dr. Shai Efrati, using hyperbaric oxygen medicine to heal the brain for stroke patients. And I said, okay, that's interesting. I'm familiar with hyperbarics with diabetic foot wounds. I had plenty of diabetic patients, and some of them weren't great controlling their sugars, and they got foot wounds, and I would send them to hyperbaric clinics locally to heal their feet. Well, it turns out that that old technology, that old concept, can be applied to different organs when applied in the right way. And Dr. Efrati's studies demonstrated this. So I was very interested. I read all his papers on stroke, traumatic brain injury, healthy aging, cognition, and call it God, fate, serendipity, whatever you call it. I got an email from a recruiter. And by the way, I get these emails every day and I delete all of them. But this one I happened to open, and it was from Dave and his company and his recruiter looking for new physicians to work at the Aviv Clinics in Central Florida. And I looked it up and I said, the villages, what are the villages? And we'll get into that a little bit later, I'm sure. But when I called and Dave explained, hey, this isn't your typical hyperbaric clinic. This is based on Dr. Shai Efrati. This is actually his company. And he interviews all the physicians applying for the job. So I said, great, I'm applying for the job. I just wanted to talk to the man himself about my father to see if his new protocol could help heal my father's brain. And then if you really want to believe in fate and everything happens for a reason, I thought this was going to be a phone call. He's in Israel, I'm in New Jersey. He said, no, he's going to be in New York City in a couple of weeks. He can squeeze you in for breakfast. That's the only time he has. Perfect. Crossed the Hudson River, had breakfast turned to brunch turned to lunch, spoke for 3.5 hours. I was really late for my office that day, but it was worth it. He was so open about his research. He told me about papers that were just published a few months ago, years ago, open about the data, open about the science and the research. His motivations is to make this protocol out there, treat as many people, as many diagnoses and conditions as possible. So when I saw, the protocol and the company for what it was and its motivations, I said, okay, this is real. And then Dave was very smart to invite me and my wife to come to Florida in February to tour the clinic. And coming from New Jersey to Florida in February, it's like, oh, I could live in Florida. But what really sealed the deal was meeting the team, seeing the clinic. I mean, the team we have here, the protocol that we use, the things that we do for our patients. that's what brought me here and has kept me here for the past couple of years.
Yeah, the universe really works in that mysterious way of connecting all those dots and bringing you to Central Florida of all places. So amazing story. Now, Dave, it's your turn. I'm pretty sure you said you had a background in IT or data technology, right?
So I started as a network engineer, quickly got into healthcare administration, and I spent 20 plus years in traditional medicine like Mo, opening up hospitals and clinics around the country. And the last 10 years working in the orthopedic and neurosciences space. So spent a lot around stroke programs. And, the first time Casper, they reached out to me, Shai and his team, I was frankly pretty skeptical. I, unlike Mo, do not have a clinical background. So I hadn't read all the research, but I knew enough to know about what hyperbaric medicine meant to traditional medicine. I quickly learned that's very antiquated. Shai's approach, the protocols that he's developed, utilizing hyperbaric oxygen in a specific manner, creates a result that's different than what we've seen historically for those diabetic wounds, and for all the traditional diseases that we treat with Hbot today.
So historically, because I do want to get into this and set the tone of even what is hyperbaric oxygen chamber therapy, because so many people have different ideas. Like I started this off, Hbot isn't just Hbot, right? And everyone has a different conception or may not even know. So maybe Dr. Elamir, could you answer just on a general level, what is hyperbaric oxygen therapy?
Sure, absolutely. So hyperbaric oxygen, simply put, is breathing oxygen in a pressurized environment. Typically in terms of medical grade hyperbarics, it could be administered in what we call a monochamber, and that's the most common type, where an occupant is laying down typically horizontally in a fiberglass tube, and that tube is pressurized with 100% oxygen. And there are some physics laws that state if you breathe a gas under pressure, that can increase the concentration of the gas in the tissue itself. So if you're breathing oxygen right now, we're all breathing 21% oxygen. And your oxygen level, your saturation can get up to a certain point. If we were all given an oxygen mask and breathing 100% oxygen where we're sitting at normal atmospheric pressure, there's still a limitation to how high that oxygen could go. But if you breathe that same 100% oxygen in a pressurized environment like a hyperbaric chamber, you can increase the concentration of oxygen directly to the tissue. So the higher the pressure, the higher the concentration of oxygen. That's what hyperbarics is in general.
Okay, now let's switch it over to how Aviv is different, because this is what I found very interesting. I came to you guys not knowing too much, and knowing hyperbaric oxygen therapy was useful, but I'd known it in the classical mono chamber as you just discussed it. So tell me about how this Hbot is different from what you just talked about in the mono chambers.
Absolutely. So what we use here at Aviv, and you might see in some big institutions like hospitals, we use what we call a multi-place chamber. And basically, Dave's background is showing it, but for our listeners, if you walked into an airline fuselage, picture that, and airplanes are pressurized when they're taking off and up in the air. But picture that, and in this case, we're pressurizing to a level of, let's say, 2.0 atmospheres of pressure. And that's how you measure the levels of pressure. That's equivalent to diving 33 feet under sea level. So this picture sitting on an airplane, closing the doors, building the pressure up, and you're given an oxygen mask instead of just breathing 100% oxygen around you all the time like a monoplace chamber. The key to this is the ability to fluctuate oxygen levels. And this is what Dr. Efrati discovered and developed over the last 15 years. It turns out that the body responds to changes in oxygen levels. The standard, when the oxygen mask is on, it's just like the monochamber. You're getting high concentrations of oxygen to the tissue that needs it. But if you just take that mask off, inside this multi-place chamber, the ambient air inside the chamber is 21% oxygen, just like we're breathing now. So when the mask is on, your oxygen level is 17 times higher. When the mask is off, it goes back to normal, which is safe. But the body perceives that normal oxygen level as a low oxygen state relative to having that high oxygen. And when the body senses or thinks it's in a low oxygen state, it's anticipating cell death. This body is very smart. If I don't have oxygen, my cells are going to die. So I should probably replace them. And the best way to replace dead cells is make new stem cells. Stem cells are blank cells that can become any cell we want it to be. So the body will make new stem cells in this response. It'll also try to build new blood vessels, something called angiogenesis, to bring as much blood to the organs that might be starved of oxygen. So this concept is relatively new. There's something called the Hyperoxic Hypoxic paradox. And the Nobel Prize was issued a few years ago for the discovery of a molecule called Hypoxia induced factor, or HIF, or HIF, as we call it here. That molecule is what gets released when the body senses a low oxygen state, triggering this cascade of healing properties. Now, I can't put you in a low oxygen state because then you're actually going to have cell death. But this discovery led to saying, hey, the body's just responding to relative hypoxia. So we just put the mask on, giving you 100% oxygen in a pressurized environment for 20 minutes, and then we'll just take the mask off for 5 minutes. Your oxygen goes to normal, it's safe, but the body now thinks it's in a low oxygen state. And you just do this protocol back and forth, fluctuating your oxygen levels. You get the benefit of high oxygen when the mask is on, but when it's off, you're triggering that cascade of healing properties.
So in a way, you're sort of working with the body to put it in a state of somewhat of a stressor, and it reacts to that stressor and then induces. Same thing you could see with cryotherapy and other types of therapies that induce autophagy and all sorts of things. And that's in direct opposition of what monochamber is, correct?
Yeah, monochamber, essentially you're breathing at 100% oxygen all the time because you're just put in the chamber. The chamber itself is pressurized with oxygen, so you're always in that high oxygen state. Now, for people with diabetic foot wounds, they're not getting enough oxygen to the distal tissue, and that's why we want to put them in there and help get oxygen to the cells to prevent them from dying. But you're really unable to fluctuate those oxygen levels the same way you can in a multi-place chamber.
Now, Dave, if you could talk us through kind of what it's like to be a patient, because I'm sure a lot of people are saying, wow, this sounds really interesting. I'm just trying to picture how this all goes down. And I walked into your facility and saw, the step to step and all the precautions, because there have to be some as well. So if someone's listening, can you tell them what they would experience from, stepping in the doors at Aviv to going in a chamber to kind of post as well?
No, love the question. So what's it like when you actually walk in the doors of our clinic? And I'm going to walk you through the story from a very personal perspective, which is that through the eyes of my dad, who at 69 years old and a full-time professor, took 3 months to come down to Central Florida. And I had the privilege of going through this treatment with him side by side every day. The first part of our program is always a thorough assessment. This is not an executive assessment like many of our patients know it. We're talking 3 to 5 days of intense cognitive, physical, and biological testing. We want to see what the brain looks like. We want to see how it's functioning. We want to correlate that with standardized cognitive tests. Physically, what's the body made of? How's it moving? How's the cardiovascular system functioning? Do we have any limitations in flexibility or movement, which can directly impact how the brain works? And what are we feeding our body? What do our labs say? Full DNA sequencing. Mo and his team will take all of this information accumulated over a week. And it really provides 2 key things. It gives us a baseline. All right, where was my dad at? And what was possible and what was not possible? And it provides us with all the information we need for Mo and his team to develop really comprehensive care plans. The foundation of it, as Mo described earlier, is hyperbaric oxygen. Once we elevate oxygen levels and elevate stem cell levels through this fluctuation, utilizing the hyperoxic, hypoxic paradox, we've triggered the body and kicked it into a highly regenerative state. And when you start overlapping different types of exercises, cognitive exercises, which are done every single day in the hyperbaric suite, it's stimulates some of that angiogenesis that Mo referred to. So my dad and I, we'd sit next to each other every single day, but we did different brain exercises. I had deficiencies from some concussions in high school that were impacting my attention. For my dad at 69 years old, his memory was starting to fade. Physically, very different. For me, it was about aerobically getting into shape. My dad, even at 69 years old, lifts weights 5 days a week, walks to work every day. For him, it was around flexibility and ensuring that he had limited fall risk as he enters his 70s. And then diet, making sure that we're feeding the body to get the maximum improvement in both our physical and cognitive function. So I told my dad before he came down, I really want you to treat this like a part-time job. All right, you're almost 70 years old. You spent the last 70 years tearing your brain down, tearing your body down. You're going to take the next 3 months and you're going to invest into a pit stop of your own health and wellness. All right. Oxygen, stem cells, exercise, diet, this combination is really what drives the results that Mo is going to talk about. So most of our clients spend 2.5 to 3 hours a day inside our walls. 2 hours of that is in one of these hyperbaric suites that's behind me. And then Mo, talk a little bit about some of the results that you've seen of your patients.
Sure thing. Every client that comes in, it starts with an initial free consultation, right, even before that assessment. Mainly because I want to make sure they don't have anything in their health history that will preclude them from even doing the treatment. Simple things or obvious things like pneumothorax, the collapsing of your lung, being in a high pressure environment could make that worse. Having active seizures could be a problem with too much oxygen. But once we get past those initial barriers, I ask them a general question: what is on your wish list? If you were to do this program, anything's possible, including if you want to be 7 feet tall with red hair, tell me. I want to know, because I'll tell you I can't do that. But if you want to improve your physical performance, I can do that. If you want to mitigate the consequences of cognitive decline as you age, I can do that. If you had a stroke and you want to see how much you can recover from your brain, we potentially can do that too. So whenever somebody comes through, we have to ascertain their wish list so we can gear everything towards it. So I've had retired NFL players come through here and say after their career, throughout all the traumatic brain injuries they've gotten, concussions, their cognition isn't the same. Their strength, their balance, their personalities have changed. So we have them come through. One example, I had one retired player. He came to our clinic a few years ago for a tour, and he pulled me aside and he said, "This is the first time I left my house in a couple of years." That's how affected he got after his playing career. He came in with sunglasses, barely talked to anybody, got through the program. We did the assessment. We saw the degree of changes in his brain and damage in his brain, and the decline physically as well. When we went through the program, you can kind of see a subtle change with time. Came in with the sunglasses, didn't talk to many people, then little by little would open up to some people here and there. By the end of the program, no sunglasses, talking to everybody, social butterfly. Even after the treatment, he comes by all the time to say hello and talk to people. He said we completely transformed his life. He felt in better shape now than he did during his playing career. He's a lot more focused. He's more active in his business endeavors. It was a completely transformative feeling for him.
And not only that, Mo, I just had dinner with him and his wife last night. And his wife Jen would tell you, it's like her husband's growing up right in front of her eyes. She spent 10, 15 years with him and on this whole decline, depression, anxiety, and to watch him grow and flourish along with their 11-year-old son. She said it last night and almost brought tears to her eyes. How often do you get to watch your son and your husband grow up right in front of you?
It can be very dramatic. And one of the biggest things that drew me to the company was their stroke research. And I had one of my very few first clients was a gentleman that had a stroke 8 years before he came to the clinic. And he was in a wheelchair. And, we told him during the assessment and even in the initial consultation, I can't bring dead tissue back to life. So those cells that are dead from the stroke, they're always going to be dead. But often with a stroke or any injury, you can have injured tissue that's not functioning properly as a result of that stroke or injury that we can bring back. And we can grow and replace some of those cells as well. So he knew the limitations, but he said, great, let's do what we can. By the end of the program, he was walking out with a cane and no longer needed the wheelchair to move everywhere. One of his things on his wish list was, I don't want to be a burden on my wife. And forgive me for being a little crass, I'm going to quote him, I want to wipe my own ass. He needed help with everything, something as simple as that we take for granted. He wanted to be able to do. And he was walking out with a cane. Wife was very appreciative and saw the changes, not just physically from the stroke, but when it comes to stroke or trauma, your personality changes. This is a phenomenon well documented with strokes and injury to the brain. You will have depression. You will have changes in your personality. And that's something that he didn't want to admit at the beginning. But by the end of it, he said, you know what? I was different and I'm back now. So he also comes and visits the clinic all the time and they're doing well.
That's one of the beauties of a true healing treatment, not just managing symptoms, not just managing disease, is that when you go through healing, there's a true change in mind, body, spirit. And it's almost that spirit that's the most vivid, that's the most changing in a person, that gets them back to their authentic self. And one of the things I did notice there when I was there, you did combine this. Listen, you got to be committed to it. You're a part of this healing process. You got to be assessed, on a daily basis, basically. So it's not just one snapshot and then when we're done, another snapshot. It's almost snapshots all along the way. So you know the progress that you're having. And in a way that sort of confirms it and gets you to be more involved and committed. And finally, I love that you did have that purpose area. Dave, we talked about it when we were in that chamber. That purpose-driven medicine is so important these days. You got to have a purpose to get better. And for many people, it's quite obvious. I just want to walk again, right? And that's an amazing, amazing goal to have. But for others, it has to be something deeper. It has to be something that really resonates with their heart. And that was really cool to see with a lot of the patients that are there. They did have these parts. They were committed. Now, you've seen the signs. You've seen the results. What is the resistance or what is the setbacks to having the whole medical field be on board with this? Because it is still somewhat, you could say, fringe. It's still not readily accepted, I guess. When you go to a stroke specialist, I'm sure their first thing they wouldn't say is go to Aviv clinics. They would try other things as well. And you know that, Dr. Mo, because you've been in that realm before coming to Aviv. So what do you think it's going to take for this to start to readily be accepted?
Yeah, it's a great point, Casper. If before my father's stroke, if you told me, oh, there's this clinic that's using hyperbarics to heal the brain after a stroke, I said, okay, I've never heard of that.
Yeah.
So I think the biggest thing is education. This protocol has been around for the past 15 years. It originated in Israel and now it's here in the US and other places. So it's going to take time. We need to educate the medical community on what is possible with this protocol. We've been prolific with our publications and our research and reproducing it over and over. We actually literally just published another paper on long COVID. That's always in the news. And just today, we published another study on how this protocol can help heal the body and the brain from the consequences of long COVID. So it's going to take a lot of research, publications, different diagnoses, different things to get to your point. Purposeful medicine. We know the pandemic of acute COVID is there, but the pandemic of long COVID is going to be much bigger. And it's going to just be prevalent longer and longer. So maybe the way I sought out the treatment for my father will be the same way people seek out our treatment. And as we get the education out there, it will grow.
Dave, speaking of education, I know Aviv has kind of that's its core to help educate the people that come in through those doors as well as the community. Could you speak a little bit about that in classes you have, ways you educate the people around?
Yeah, I mean, it has evolved. I would even go as far as to say that Dr. Elamir and his clinical team spend a third of their time just educating the community. CME events for physicians in the healthcare community, seminars, conversations, even the one-on-one consults that Mo has are very educational. There's two different forms. One, Mo did a great job of articulating some of the barriers we're encountering in the healthcare community, but even in society, we have a society that is very much a quick fix society when it comes to their own body, in addition to every other aspect of life. Our bodies didn't break down in a couple of days. It's decades of deterioration and microvascular changes that have led to this cognitive decline. It's going to take a couple of months to heal it and see that rejuvenation. And so, when we're trying to educate a society that is looking for a pill, looking for a quick fix, compounded by the fact that they're expecting insurance to cover everything, puts us in a difficult position in a dichotomy that is changing. I do believe the pandemic has really brought the importance of one's health and wellness to the forefront as a priority in many of our society. But we still have a long ways to go. And I think the U.S., really, when it comes to health and wellness, trails a lot of other countries in just how their societies look at this.
Yeah, it's definitely, listen, I know from my side of it as well in the integrative field that it's difficult to change minds and belief systems. And I still do think that most people are in the traditional sense in a belief system that conventional medicine will save me. That regardless of what I do to my body, how poorly I eat, all the stress, everything else that by now we know is not good for us. Let's not, try and say, oh, I didn't know that, eating McDonald's daily and smoking cigarettes is bad. No, you can't use that one, but you can there is a pill for it. There is a surgery for it. And unfortunately, I think there needs to be this big differentiating factor of managing disease versus actually healing and restoring health. And that's what you guys focus on. That's what we focus on. And it's a total different approach. It's not the short term pop a pill for any ill and those symptoms go away, but you're still sick, really. You stop popping those pills and you'll see what happens. And that's where I think people need to change and embrace that long-term approach and really start to focus on the greatest wealth. Because I'm sure you ask any one of the patients that walk in Aviv that don't have the capacity to use their brain properly, they'd give up anything to have that back. They would pay any amount to have that back. And let's talk a little bit about that, because when they go through these 12 weeks, which is pretty, you could say rigorous, you're asking them to make changes to their lifestyle, to go there, to live there, basically part-time job, as you said. When they come out the other side, what's it like? Do you see them, you mentioned the football player, of course, but should people expect to be changed by this in 12 weeks? Should they expect to really see vast improvement, or are they still on a healing journey? What to expect after those 12 weeks?
Yeah, it's I break it down into a couple of different silos. The first one is clinically, what can you really expect? Because I told them I wouldn't be down here if it wasn't for the science and the research and the data, and we need to make sure we stay consistent with that with every client. So that rigorous 3 to 5 day assessment that we do before assessing the brain for those changes, assessing the cognition, the physical performance, etc., we do at the end as well. So objectively, I can show you your brain after the program, how we were able to build new blood vessels, improve the metabolic function, grow new stem cells in the brain, and how it translates specifically to your cognitive scores that improved and your physical scores that improved, your efficiency, metabolism, all of those things. We can objectively show you pre and post. So that way you know for sure what actually happened to your brain and body. That's one side. My favorite part of that final summary meeting is to take an anecdotal experience from the client themselves, or more commonly from a loved one that notices it in that client, saying, hey, you remembered what I told you in the morning, and I didn't have to repeat myself 3 times like I always have to do. And I noticed that 2 months in. And little things like, oh, I can now tie my shoes. I couldn't do that for 10 years. We had one client where physically and cognitively she was impaired, that physically getting down there to tight, and then cognitively just being able to do it. She wasn't able to do. And midway through the treatment, she was ecstatic because she could tie her shoes again. Something so simple. And that's what most people notice. It's these subtle day-to-day things that become a little bit like a light bulb coming off. Like, oh my God, I can do this again. Yes, we have those drastic changes like stroke patients able to walk, but often it's those healthy aging clients that have deteriorated over time where they start to bring those back. And even more, I tell everybody, you're going to do well through this program. You're going to do the best if you really take all the other things around the hyperbarics that we teach you, lifestyle changes, diet, exercise, cognitive engagement. And you have to continue those after the 12 weeks are done, because this, even though 12 weeks is longer than a quick fix, it's still not done. It's not a stop and start process. You continue those diet changes, lifestyle changes. So when we do a 6-month follow-up for all our clients and we repeat some of those tests, I often see an improvement at that 6-month mark than I did immediately after the program. And I tell folks it's for 2 reasons. Number one, the reason why this treatment is 12 weeks is because we figured that this stem cell production continues even after the 12th week. That's why it's so long. We have to keep that triggered regenerative process going. So you're still making stem cells after you leave here. And if you continue to do all the good lifestyle choices that you learned throughout your 12 weeks, you're going to keep those stem cells going in the right direction to the parts of the brain and body that need it. And that's why you'll do even better 6 months later or even 2 years later.
Yeah. And it seems that after 12 weeks, you've already reprogrammed certain behaviors that were there that were non-beneficial into beneficial behaviors that will continue the healing process through lifestyle, through education, through the stem cell initiation and all other parts of that. So it really is, I appreciated that about you guys, that you're looking at it from the long term. It's not 12 weeks, you're done, go home, keep doing whatever you want to do, and that's it. You're going to keep healing after that. And healing is a lifelong journey. But, those 12 weeks serve as such a catalyst to get them somewhere. And now looking beyond the brain, because I think you guys have done a good job at really setting up that, Aviv clinics and the Hbot you do there, really good for the brain. But are you looking at other areas as well? Because we know it can increase blood flow. So you talk about things like heart conditions, you talk about anti-aging, you talk about optimal performance. I know lots of athletes, you see them, they have their own mono chamber at home that they sleep in, they say, and do all these things. But you could make the case that, hey, come in here and you could see actually great improvement over that. So are you starting to look at that and starting to attract those types of patients as well?
Absolutely. We have folks that come in who are current athletes that, whether it's recovery from an injury or to gain that extra edge in the next season. This concept of making new stem cells, growing new blood vessels, it's not just a treatment, but it's also preventive and performance oriented. So that way we can get people to come in here, do the treatment, perform better in their profession or their sport or whatever it is. But it goes for the healthy aging person too. You don't have to be a professional athlete to get a benefit. If you're feeling great, you'd like to play golf. We had one healthy ager. He was the leader of his hiking group. And he loved hiking, and he would go and he noticed, hey, I'm not leading the group like I always used to. I'm trailing behind a little bit. And on the golf course, I love playing golf. I'm still able to go out there multiple times a week, but now I feel like I need an extra day to recover after each round of 18. So he went through the program just to say, hey, I want to optimize my performance. So by the end of it, not only did we help his brain and cognition, but his performance in hiking, he was leading the group again. On the golf course, a funny story was one day a week, he would have a kind of round with the guys, and they would put money on the game. And he would win here and there. But by the end of the program, he was consistently winning, just taking their money. And they asked him, hey, what are you doing? And he didn't tell them about the program. When we asked him, hey, why aren't you telling people about this? He's like, I want to keep winning money. I don't want them to know my secrets.
It's his secret now, right?
It's the secret sauce. So it doesn't matter if you're a professional athlete gaining that extra second, extra pound, extra edge, or if you're that person that wants to stay active or optimize your performance, whether it's in a boardroom or a golf course. We have people coming in for that mindset as well.
Well, the secret is out now, so his buddies may catch up to him soon. Sticking on that a little bit, would you ever advise someone to purchase their own hyperbaric chamber as a complimentary thing, afterwards, let's say?
Well, Mo,
yeah.
I want you to answer that in two ways. So first, and I'll have Mo address the safety, but there's two types of hyperbaric chambers that people think about purchasing. The most prevalent one is the tent-like versions, the ones that zip up. Those only go to a certain pressure. And so you're not able to get the benefit in terms of oxygenation of the tissue, let alone the increase of stem cells in those. They might be great for some recovery after pretty exhaustive exercise, but their limitations stop there. Mo, we've had a number of our clients who've expressed interest of installing a monoplace chamber in their homes. I'll let you address some of the safety concerns that you and the team have around that.
Yeah, when you asked Dr. Efrati from Israel, what about these tents and these home chambers? And forgive me again for quoting, but it's bullshit. That's not hyperbarics. True medical hyperbarics involves these hard chambers, whether it's a mono chamber or a multi-place chamber, but the ability, as Dave mentioned, to get up to that specific pressure level. Some of those tents and home chambers can go maybe up to 1.3 atmospheres, and there might be some benefit in some recovery here and there. But the purpose of our treatment is to make a significant physiologic change in the body, producing a significant amount of stem cells and growing new blood vessels, improving the mitochondrial function. We didn't really mention that. That can only be done by doing this specific protocol. Now, for those who are able to buy or purchase a hard medical chamber and put it in their house, this is a medical device. You wouldn't perform surgery on yourself at home. And I want people to think of it like that. There are a lot of risks if hyperbarics aren't done properly. My team here, they're the top professionals in terms of safety and administration of this medical treatment. That's what this is. If you dare to Google hyperbaric accidents and you see explosions and catastrophic issues, even in some clinics that don't do it properly, you need to have a thorough, certified team to really administer this treatment to make sure you're doing it properly, not just for the obvious explosions with oxygen, but even for your health. Breathing too much oxygen in an unsupervised way is dangerous. Oxygen-free radicals, oxygen toxicity, those are real things. So even if you don't have a catastrophic explosion, you could be hurting your health by just sleeping in an oxygen tent for God knows how many hours.
Yeah, and I saw that safety area you guys have there at Aviv, and it is impressive. It looks like a whole thing, that you'd see in the CIA or something, overlooking everything, all the buttons and systems they got to overview. So I get it. It is, as with most therapies, trying to do something that is a medical therapy and procedure at home is usually not the best, and cutting corners on that is usually not the best idea. We see that a lot. We do ozone therapy and different types of therapies, oxidative therapies here, and people try and say, let me mimic that at home. And it's like, well, you really shouldn't be playing around with that, especially when it's your health and you have, all these medical professionals available to you. Now, you mentioned mitochondrial function. And one thing I had that came to mind even before we got on this was the idea of combining hyperbaric oxygen chamber therapy with NAD therapy. So we do NAD infusions over here, especially on a lot of the patients that have Lyme disease, cognitive dysfunction. And we know NAD really powers the mitochondria. And where does most of that power go? For the brain? The brain, sucks up that energy. About 20% of energy is utilized by the brain. Have you seen anything or ever thought about or maybe even done anything with a combination of NAD therapy with Hbot?
Yeah, we have a lot of clients. Often the clients that seek us out, they seek out other ways to help their health, and a lot of clients bring this up. Conceptually, yeah, you can help augment some of the benefits, especially the mitochondria with NAD. What I tell most clients is, let's do one thing at a time, because A, we want to make sure we're doing it safe, and number two, you want to see the specific effects of one treatment on your body and how it goes. So, that's something I've worked with in the past, whether it's NAD or glutathione, IV vitamins, those kind of things. Our assessment will help say, hey, this is something that you should do before or after our program, and tying in other nutritional components as well. So, for sure, medicine isn't a single track. You have to incorporate other things and address whether there's deficiencies or other metabolic issues to make sure you're doing the right thing for yourself.
Absolutely. Dave, what's next for Aviv? Are you guys looking to expand, open up new clinics, do anything other?
Oh, absolutely. So we have our prototype and the first of its kind here in Central Florida. We opened up a second clinic in downtown Dubai, which is growing rapidly. And we're in the process of bringing our third clinic to your neck of the woods, Casper, New York. I think we're probably still 18 months away from that, but coming soon. But as Dr. Elamir said earlier, Dr. Fradi's goal is bringing this to the world, making this available to everyone who struggles with cognitive decline, whether it's from a stroke, traumatic brain injury, or it's just, those senior moments that are creeping up and accumulating over time. That's why we exist. And it is our goal to bring this to the public, continue to produce research that helps educate our healthcare community, and frankly, ultimately makes it available via insurance companies to all of those who can't afford it today.
No, it's a wonderful goal. And listen, I've been down there. I've talked to you guys extensively about it. And I think it's incredibly important, in medicine to embrace these sort of things, to focus on education, to look at root causes and address them in a way that doesn't have any side effects. And that's a little bit, I think, of the problem with most of medicine is that we're using this as the last resort when it should be the first. If that didn't work, then you could go on to the brain surgery and toxic and, drugs with lots of different side effects. I totally see a place for them. But why not start here? Why not start with something as simple as oxygen, right? Something every single cell in the body needs. And it can be so healing. So, great job with that, guys. Where can people learn more about Aviv Clinics and yourselves? Hey,
well, there's couple of different options. Our website is aviv-clinics.com, aviv-clinics.com. That's the best way. You can also reach out to our team at any time. It's 352-488-AVIV, 352-488-AVIV. And Mo and his team are available anytime. Someone has questions, wants to learn more. Mo fields phone calls from physicians on a daily basis, just educating them, educating their patients on what's possible.
Love that. Dave, Dr. Mo, thank you so much for coming on.
Casper, it was a pleasure.
When you're thinking about what's the most important thing in health, it's really hard to isolate one thing, but you have to say the brain is so critical. It's what makes us human. It's what gives us emotions. It's what separates us from most of the animal worlds. And I think really focusing on prioritizing and optimizing the brain is the way to go in the future of medicine. So if you want to learn more about Aviv, go over to their website. We'll put it up on the website as well. And I think it's a wonderful, wonderful option for a lot of people that are suffering with brain injuries and just poor cognitive function. Until next time, keep writing your own healing story.